Hi everyone, and welcome to this evening's Brace Bites. And the FAQ for today is can I go to my dentist for braces? And the reason we chose this topic this week is that we have had a couple of patients that have come in, and this has stimulated this sort of conversation, and we thought it would be nice to give people an idea of why that question comes about, what the answers are to that question, and how we perceive things, I suppose. So one of the things that people come in and say to us is, coming to see you, love the sound of who you are, love the sound of what you do. Can I just go to my dentist and have my brace done? And I think it's important to understand what the different options are for you as a patient as to who can deliver this service for you, for your braces, for the outcome that you're looking for, and for the stability and the long-term health of your teeth as well. And so I suppose what I would like to say is that, of course, your dentist can do your braces for you. The dentists that are qualified in this country and elsewhere as well are very, very well experienced. When we are training to be dentists, we do a little bit of everything. And so we know we have experience in all the different fields of dentistry. But I suppose what I would say is being a general dentist is like being a GP. So you are very knowledgeable, you have a vast range and a big scope of knowledge, but not necessarily specific knowledge about certain things. And so whilst there are many dentists that deliver great treatment outcomes, it's not necessarily something that they're doing on a day-to-day basis. So as specialists, I suppose what we would say would be like your GP referring you on to somewhere for a more complicated or a more specific advice, or for somebody who has knowledge in a very specific part of your body. And that's what orthodontists are when it comes to straightening teeth. And so as specialists, what a specialist is somebody who has done more training. So that's normally anywhere between 2 to 3 to 5 years more training to do braces. And it's often somebody who just does braces all day long. So of course you're getting a lot of experience under your belt. You're seeing a vast range of patients, and you're delivering that kind of care day in, day out. So, you often see where people say, so for example, with the Invisalign Platinum provider, Diamond provider, so you can say that actually we've done X number of cases per year, so 150 cases a year. So people that come to see us know that we've got a certain level of experience. People that come to see a specialist know that a specialist has taken an exam to prove that they can do the brace treatment that is required, that they understand the complexities of treatment, they understand how teeth move, and it's a comprehensive course that is judged and peer reviewed at the end, and that takes, like I said, 3 years to do that. And so I suppose the question is, when you say, can my dentist do my brace for me? Can I go to my dentist for my braces? What is it that you're looking for? Now, of course, it's great that so many patients have a really good relationship with their dentist, not sort of like we used to have before, when people would always hate going to the dentist and they're always worried about what it might happen at the appointments. And so it is nice for you to be able to approach your dentist for treatments because you've built up that trust, you've built up that loyalty with that person. And like I said, there are dentists out there that will deliver you a great result, but in the same way as well, they are the jack of all trades. And whereas a specialist, whether that be an orthodontist or an orthopedic surgeon or a trauma specialist, whether it's medical or dental or what have you, it is somebody who is doing that specific field day in, day out. And so are you looking for convenience? Because of course your dentist probably is convenient because you know how to get there, you've been going there for a long time. Are you looking for a great outcome? Because of course you'd hope that a specialist will be able to give you the outcome that you're looking for, having had that much more experience and that much more knowledge in the field. Or are you buying on price? Because of course one of the worrying things these days is the rise of sort of direct to consumer braces, whereby people just sort of send in molds of their teeth and kind of end up with a brace. And of course we worry as dentists or specialists, we worry about things like that when nobody's actually looked in your mouth to see what's going on with your teeth, and nobody's directly had a look at them, nobody's done an x-ray for you. But of course there is a price point that makes that appealing for some people, and they're willing to take the risks that go along with that treatment. And so what I'd like to say is that there are lots of different people that could potentially do your brace for you, but your brace journey is going to be a reasonably long one. It's a matter of a few months, and it's going to be a reasonably complex one depending on the type of treatment that you have and what you're looking for your outcome to be. And so you find that a lot of dentists love and are absolutely brilliant at doing that kind of first sort of 6 teeth, as we call it, the social smile. So you get your teeth straightened at the front, a little bit of tooth whitening, a little bit of edge bonding, and you've kind of got that really nice Instagram smile. However, if you're looking for things that are a little bit more complex, when you're looking at maybe straightening out the whole of your arch, where you're looking at improving not just the way that your teeth look, but the way that your teeth bite, and looking for the health that can be benefits that go along with braces, then you're possibly looking at something that requires a little bit more complexity, and maybe that's when you'd be looking at a specialist in order to do that for you. And I guess what I'm saying is, as well as the nice thing about going to see a specialist, is that they'll be working with a specialist team, that everybody in that practice there is well versed in braces. If you have any problems, there will always be somebody there that's going to be available for you, whether that be the receptionist or the patient coordinator or one of the nurses or even one of the clinicians themselves. And so it's important that you make the right decision for you. It's important that you make the right fit for you, because like I said, it's going to be a reasonably long journey. But most importantly, it's important that you know all your decisions that are there and all your choices that are available for you, so that you are able to make the right decision for you. So I hope that helps. I hope that gives you some answers. I hope that answers the questions that some of our patients have been asking us this week as well. And we will see you again next week. Have a great week, everybody. Nice to see that the sun's shining, and I will see you later. Take care. Bye-bye.